Our GMA cover story, more on questions about the coronavirus pandemic and whether the U.S. healthcare system is prepared for a possible escalation. We saw what's happening in Italy, and the big question is, could that happen here too in our hospitals? And Steve Osunsami joins us now from outside CDC headquarters in Atlanta. Good morning, Steve.
Good morning to you, George. Here from the CDC, health officials here are warning that hospitals across the country in both rural and urban areas could see a flood of coronavirus cases. Already, doctors from coast to coast are sending emails to their patients warning them not to come into the doctor's office if they're sick with this, but instead to head into the emergency room. Hospitals across the country this morning are bracing for the worst, with tents like these popping up outside emergency rooms. Boston, San Jose, and Salt Lake City setting up what they call surge tents. Inside them, healthcare workers are preparing for potential overflows and the need to isolate people sick with the coronavirus. Some health officials are also worried that there are not enough medical supplies.
I believe that if we have a major outbreak, we are definitely vulnerable to shortages.
Something they need greatly are ventilators to help patients who are having trouble breathing. A 2010 Cambridge study estimated that there were only about 160,000 ventilators in the U.S. that can be put into the field. But based on the current infection rate, the number of ventilators needed in this pandemic could exceed that. Northwell's Plainview Hospital on Long Island in New York says they're prepared, giving GMA a behind-the-scenes look at additional beds and ventilators that they have at the ready.
So when you would come into our emergency department, you would see a typical stretcher that we place patients on. We have equipment to monitor patients' vital signs, and in extreme cases, if needed, in extreme severe cases, we have ventilators if needed, patients in severe distress.
This is why so much stock is being put into social distancing. There is the hope that this will ease some of these concerns.
Have to flatten that curve. Okay, Steve, thanks very much. Jen Ashton is back for more on this right now. So explain to everybody what we know about our capacity right now.
Well, the short answer, George, is the U.S. critical surge capacity to deal with a public health crisis is unknown. Okay, the last real data came from 2015, 2013, 2010, but I want you to think of 4 S's here because it really depends on these 4 factors. It depends on space, it depends on supplies, so not just ventilators, but other supplies that we use to care for critically ill patients. It depends on staff and systems. There's a lot being made now about the number of ventilators. Ventilators don't run themselves. They need respiratory therapists, they need critical care nurses, and that is really the rate limiting step in that. So all of these factors have to be taken into account.
And there are so many concerns out there, Doc. What can we do to address these concerns?
Well, look, a lot of that stuff should have been going on in the past. We can address things right now. There's a system or theory called reverse triage. If our healthcare systems and our hospitals become overwhelmed, then it's careful and safe disposition of patients who can go home or can go to other facilities, rooms being transferred from one purpose to another. And I'm sure that major medical centers and hospitals are starting to look at that right now. But that's why it's so important to remember that hospitals generally don't have a lot of free beds. Anyone who's been in one recently knows that. So it's not like they're just sitting there vacant waiting for patients. That's why it's so important on a community level, a population level, and an individual level to take steps so that the patients who need care of all kinds for all reasons in hospitals can still get that care.
Have to get ahead of it.
Yeah, absolutely.
All right, Doc, thank you so much. Appreciate you, as always.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.